I wanted to be a dentist when I was probably about 14 years old, 15, you know, right before trying to figure out what would be a good occupation for me to where I could still be goofy and also have an impact on other people's lives.
And that's one thing that is special about our practice is that all the doctors love the kids. That's what makes our practice special, is getting to come in and play with them, and we get to guide them. You know, they start out as a fearful patient, and we get to guide them into being a happy, healthy patient.
Just knowing that they trust you with, you know, treating their child and giving care to their child, and just seeing these little ones from when they were 3 and now they're, you know, 35 and they're bringing in their own kids, watching them grow up.
I love to goof off. I love to have fun with the kids. To me, it's very important to kind of help them grow, kind of nurture them, help them get through visits.
So we have a team approach in the office. We're going to work with the families. We're going to get these kids in better shape.
Everyone thinks of a dentist as someone you go to get something fixed. You know, when you go to a doctor, it's not always to go to get something fixed. It's about to get advice. It's about preventing problems. And that's what we want to be too. We want to be here for educating you how to prevent problems.
The more routine you are and the more they get familiar with it, the better they get. And then there's, you know, they get to the point where they trust you too.
I mean, that's our philosophy in the office is, what would you do if these kids were your own kids?
I want kids to grow up and to be, you know, become adults and not hate the dentist.
Pediatric specialty. That generally requires 2 more years of training. It has more to do with the psychology of the child.
We always let the parents come back so they can be part of that experience. We're not only guiding the child through the dental visit, but we're also guiding the parent through what's expected at the dental visits and what they can expect as their child grows.
You know, they come in and, you know, they're amazed that, you know, we get into the child's space and we tell them what we're going to do and we show them.
They're proud of themselves when they're done, and we like to see them be proud of themselves.
Life can get really hectic, and so Saturday appointments are really nice for those guys that are on the go.
I think sometimes the most rewarding patients are the little ones that have a lot of dentistry that needs to be done. The parents are very concerned because other places they've been have wanted to put them to sleep. And when we tell the parent that we can treat them in the office and we can treat them safely, and we guide them through the process of how we do that, the parents are usually very grateful.
If adults are mad or if they're happy, you know, sometimes they'll kind of just sit there and just kind of relax because it's not quite appropriate to be like, yeah! But like kids, you know, when they're done, they're like, that was it, that was great. They're smiling, they're giggling, they go up to the mom and they grab the mom's leg and jump around and be like, I did it. You know, so you can usually tell when they have a good experience.